This is Section 4 of the 2017 Wisconsin HIV Surveillance Annual Review webinar. This section will address new HIV diagnoses, prevalent cases, syphilis diagnoses, and HIV testing in the city of Milwaukee during 2017. During this webinar, Milwaukee refers to the city of Milwaukee, unless otherwise specified. Similar to the statewide report, this graphic will help us understand the flow of people living with HIV in and out of Milwaukee, and who is included in the estimates of new diagnoses and prevalence. Imagine this graphic represents individuals living with HIV in Milwaukee. Each year, there are 3 different groups of people living with HIV who are counted in the annual report. The first group are those who receive their initial diagnosis in Milwaukee during the calendar year and are being reported for the first time. In this diagram, these people are represented in red. These new diagnoses give an indication of how prevention and testing strategies are working. In 2017, there were 118 new HIV diagnoses made among Milwaukee residents. The second group of individuals in the report are those who were diagnosed elsewhere but moved into Milwaukee during the calendar year. Many of these individuals have been living with HIV for many years and therefore are different than those who are newly diagnosed in Milwaukee. Individuals who were previously diagnosed and move into Milwaukee are not included in the analysis of new diagnoses, but they are included in the prevalent population. There were 48 individuals previously diagnosed in another state or country who moved into Milwaukee during 2017. The third group of people are individuals who are already living with HIV in Milwaukee. They were diagnosed or moved into Milwaukee prior to 2017. Before we can calculate overall prevalence, we have to account for individuals who moved out of state or died during the calendar year. These are subtracted from the overall prevalence. To calculate Milwaukee's 2017 HIV prevalence, we count the new diagnoses in 2017, add the people moving into Milwaukee, add individuals already living in Milwaukee from past years, and subtract those who died or moved out of state. The 2017 year-end prevalence was 2,991. However, the Centers for Disease Control and Prevention estimate that 16.7% of people living with HIV in Wisconsin are unaware of their HIV status. So the actual number of people living with HIV in Milwaukee is probably close to 3,600 people. This section addresses new HIV diagnoses. This figure shows the trend in the annual number of new HIV diagnoses, shown as the blue bars, and the HIV diagnosis rate, shown as the green line, in Milwaukee between 2008 and 2017. There were 118 new HIV diagnoses among Milwaukee residents during 2017, at a rate of 19.8 new diagnoses per 100,000 population. Between 2008 and 2017, both the number and rate of new diagnoses fluctuated, with no clear trend. The number of new diagnoses over the last decade ranged from a low of 102 in 2012 to a high of 136 in 2010, with an average of 116 new diagnoses per year. Milwaukee is disproportionately affected by HIV, as the city makes up just 10% of the state's population, yet 46% of people newly diagnosed with HIV in 2017 lived in Milwaukee. The diagnosis rate was 7 times higher than the rate for the rest of Wisconsin, excluding the city of Milwaukee, 2.7 per 100,000, and was higher than that for the nation as a whole, 12.3 per 100,000. Of metropolitan statistical areas, or MSAs, geographical regions with a relatively high population density at their core, the Milwaukee area had an HIV diagnosis rate ranked 75th out of 108 MSAs in 2017. Nearby MSAs with lower rates included Minneapolis, 7, Des Moines, 6, and Madison, 4. Knowing where people receive their HIV diagnosis helps us to understand testing patterns and subsequent linkage to care for people who test positive. During 2017, the most common settings for HIV diagnoses were outpatient clinic, 34%, local health department, 17%, and publicly funded counseling, testing, and referral, or CTR sites, 14%. During 2017, 98 males and 19 females and 1 transgender person were diagnosed with HIV in Milwaukee. The median age at diagnosis, the age at which half of people were older at the time of diagnosis and half were younger, was 29 years, with a range of 16 to 67 years. Newly diagnosed males were younger than newly diagnosed females. The median age at diagnosis was 27 years for males and 44 years for females. There were 14 individuals aged 15 to 19 years diagnosed with HIV in Milwaukee during 2017. While there was no clear trend from 2008 to 2017, the number has been increasing in recent years. This figure shows trends over time in the HIV diagnosis rate for males and females in 2 age groups, ages 13 to 29 and ages 30 to 59. Over the last decade, 2008 to 2017, the HIV diagnosis rate fluctuated across most age and gender groups, including males ages 13 to 29, males ages 30 to 59, and females ages 13 to 29. There was a significant decrease, shown in dotted green, among females ages 30 to 59. Diagnosis rates among males and females ages 60 and older are unreliable due to small numbers. There were 27 transgender individuals excluded from this analysis as population denominators are not available to calculate rates. This figure shows the number of transgender individuals diagnosed with HIV in Milwaukee over the last decade. The term transgender refers to people whose gender identity does not conform to their sex assigned at birth. It includes people who self-identify as male to female or transgender women, female to male or transgender men, and many other gender nonconforming identities. A transgender person may have the anatomy of their sex at birth, the other sex, or a combination. Gender identity and sexual orientation are separate, distinct concepts, with gender identity referring to an individual's sense of themselves and sexual orientation referring to an individual's attractions and partnering. A total of 39 known transgender individuals have been diagnosed with HIV in Milwaukee since the beginning of the epidemic. While the data collection of self-reported gender identity has improved over time, this likely underestimates the true number of transgender individuals diagnosed with HIV in Milwaukee. Of the 39 known diagnoses among transgender individuals, 27 occurred between 2008 and 2017. Of these 27, all were people of color, and most were under age 30. For a variety of factors, transgender people are at high risk of HIV, including barriers faced in healthcare settings due to providers' lack of training on transgender people's unique needs, stigma, discrimination, social rejection and exclusion, and higher levels of violence against transgender people. This figure shows the trend in the percent of new diagnoses each year among whites, shown in green, compared to people of color, shown in blue. In the 1980s, the majority of new HIV diagnoses in Milwaukee occurred among whites. Since the late 1980s, the number of diagnoses among racial and ethnic minorities has exceeded that in whites. During 2017, 8 out of 10, or 83%, of people newly diagnosed with HIV were people of color. Yet people of color make up approximately 55% of Milwaukee's population. This health disparity is not due to innate biological factors. Rather, other determinants of health, such as poverty, unequal access to healthcare, lack of education, stigma, homelessness, and racism can disproportionately affect persons of color and can put individuals at greater risk for acquiring HIV. This figure further highlights the disproportionate impact of HIV on people of color in Milwaukee. Black males are 4 times more likely to be diagnosed with HIV than white males. Similarly, Hispanic males are 2 times more likely, and multiracial individuals are 2 times more likely to be diagnosed with HIV compared to white males. Although the number of females diagnosed with HIV is much lower than males, the racial ethnic disparity is greater. Compared to white females, Black females are 6 times more likely, and Hispanic females are 3 times more likely to be diagnosed with HIV. The next few slides will be about the most likely risk factors associated with HIV transmission. This figure shows the adjusted risk for Milwaukee and for males, females, and transgender people separately during 2017. Please view the Data Concepts module of this webinar series in order to learn more about adjusted risk. The overall risk profile for 2017 was 75% male-to-male sexual contact, 16% heterosexual contact, and 8% injection drug use. Among males, 90% of all diagnoses are attributed to male-to-male sexual contact. Among females, 78% of diagnoses were attributed to heterosexual contact and 22% to injection drug use. This figure shows the trend in the number of new diagnoses between 2008 and 2017 by estimated transmission category. The estimated number of new diagnoses has been stable among MSM, shown in dark blue. Diagnoses attributed to heterosexual contact have declined. Prior to 2016, HIV diagnoses attributed to injection drug use were stable or declining, but an increasing trend has been observed since 2016. For providers of prevention and testing services, it is important to know the ages of people for targeted messaging. One common age metric is median age at diagnosis. Median age at diagnosis is the age at which half of people were older and half of people were younger. This graphic shows the median age for all people diagnosed during 2017, the 3 major risk groups, and MSM by race and ethnicity. The median age at HIV diagnosis during 2017 was 29 years old. The oldest median age at diagnosis was among people with a reported transmission factor of heterosexual sex. The youngest median age was among Black MSM at 25 years. While the overall number of diagnoses attributed to male-to-male sexual contact has been stable, there have been changes among some groups. This figure shows the trend in the number of new diagnoses between 2008 and 2017 for MSM under age 30. The number of new diagnoses attributed to male-to-male sexual contact among young men of all racial and ethnic groups fluctuated over the last decade, such that there was no defined trend. This figure shows the zip code of residence for new HIV diagnoses in Milwaukee from 2015 to 2017. During 2017, new HIV diagnoses were made among residents from 23 Milwaukee zip codes. Zip codes with the largest numbers of new diagnoses were 53208, 13, 53215, 12, and 53209, 53212, and 53216, 10 each. All other zip codes had fewer than 10 new diagnoses each. During 2015 to 2017, new HIV diagnoses were made among residents from 27 Milwaukee zip codes. Zip codes with the largest numbers of new diagnoses were 53209, 32, 53208, and 53216, 27 each, 53212 and 53218, 26 each, and 53210, 25. All other zip codes had fewer than 25 new diagnoses each. According to the CDC, late diagnosis occurs among individuals who progress to stage 3 HIV, or AIDS, within 1 year of receiving their initial HIV diagnosis, including those who have progressed to stage 3 by the time they are first diagnosed with HIV. Stage 3 HIV typically occurs 8 to 10 years after acquiring HIV in the absence of treatment and is based on very low CD4 count and/or a stage 3 defining opportunistic infection. Early diagnosis is thus important both for optimal health outcomes for the person living with HIV and for reducing the risk of further HIV transmission. The percentage of people diagnosed with HIV in Milwaukee who had already progressed to stage 3 by the time they were first diagnosed with HIV shown in blue, declined from 25% in 2013 to 11% in 2017. Each year, individuals who were previously diagnosed with HIV in another state or country move to Milwaukee and are reported to the HIV surveillance program. During 2017, there were 48 individuals newly reported with HIV in Milwaukee who were first diagnosed outside of Milwaukee. This is depicted in the circle chart on the left. People previously diagnosed with HIV who moved to Milwaukee most commonly moved from Illinois, 16, a foreign country, 7, Georgia, 3, Florida, 3, and Mississippi, 3. The number of people living with HIV at a given point in time is termed prevalence. As described in the beginning of this presentation, prevalence includes people newly diagnosed with HIV, people already living in Milwaukee, and people that moved to Milwaukee. In 2017, there were 2,991 people living with diagnosed HIV in Milwaukee. HIV prevalence by last known zip code of residence is shown here. Zip codes with the highest reported HIV prevalence were 53208, 261, 53204, 256, 53215, 224, 53203, 215, and 53212, 194. Syphilis diagnoses can be an indicator of HIV risk within the community of gay, bisexual, and other men who have sex with men. Sores associated with syphilis can make it easier to transmit and acquire HIV. According to the CDC, gay, bisexual, and other men who have sex with men accounted for over 81% of all primary and secondary syphilis diagnoses in the U.S. during 2015, among males for whom sex of sex partner was known. Males ages 20 to 29 have the highest syphilis diagnosis rates nationally. Among males in Milwaukee, the total number of primary and secondary syphilis diagnoses increased between 2010 and 2017, with a median number of 34.5 diagnoses per year. Between 2013 and 2017, 42% of men aged 13 to 29 diagnosed with syphilis were living with HIV. HIV testing occurs in a variety of settings, including publicly funded test sites and private medical clinics. This section provides information about new diagnoses identified at the Counseling, Testing, and Referral (CTR) sites in the city of Milwaukee, funded by the Wisconsin Division of Public Health. These CTR sites include community-based organizations and the City Health Department. From 2013 to 2017, the new diagnosis rate for the CTR sites in Milwaukee was 0.5%. The new diagnosis rate was higher among men who have sex with men. The new diagnosis rate was the highest at 1.8% among Black MSM, followed by Hispanic MSM. Among Black MSM, the new diagnosis rate at CTR sites was the highest in the 20 to 24 year age group at 2.8%, followed by the 18 to 19 year age group and the 30 to 34 year age group over the 5-year period. Among Black MSM, the number of HIV tests conducted by CTR sites in Milwaukee has fluctuated around a median of 963 tests per year during 2013 to 2017. New HIV diagnosis rates ranged from 1.1% to 2.9% during this time period, with a median of 1.8%. The HIV care continuum is used to measure and monitor HIV engagement and health outcomes. The HIV care continuum is used at the state, regional, and local levels to measure and monitor HIV engagement and health outcomes across the continuum. The care continuum here depicts timely linkage among individuals diagnosed with HIV in Milwaukee during 2017 and care patterns during 2017 among people living with HIV at the end of 2016, and compares Milwaukee with the state. The first bar depicts those who are at high risk for HIV, the bar before the bars. Factors that put people at higher risk for HIV include male-to-male sex without a condom or pre-exposure prophylaxis, sharing injection drug use equipment, and heterosexual sexual contact with a person living with untreated HIV. The size of this population is not known. These risk behaviors occur in the context of social determinants of health, such as poverty, unequal access to healthcare, lack of education, stigma, homelessness, and racism. The subsequent bars are based on surveillance data. The second set of bars represent those who are diagnosed and living with HIV. All individuals reported with HIV in Milwaukee by the end of 2016 who are still alive and living in Milwaukee by the end of 2017 are represented by the second blue bar. The third set of bars represent those who were linked within 3 months of diagnosis. 87% of individuals newly diagnosed with HIV in Milwaukee during 2017 were linked to care within 3 months of HIV diagnosis. The fourth set of bars represents those who are in medical care. 73% of individuals diagnosed and living with HIV in Milwaukee had at least one medical visit, using laboratory data as a proxy for medical care during 2017. The fifth set of bars shows who was retained in care. 56% of individuals diagnosed and living with HIV in Milwaukee were retained in care and had 2 or more medical visits during 2017. The sixth set of bars shows the percentage of people who are virally suppressed, or having a viral load of less than 200. 65% of individuals living with HIV in Milwaukee were virally suppressed at their last viral load test during 2017. Finally, the last bars show those who are virally suppressed among those tested. 89% of individuals who had a viral load test during 2017 were suppressed at their last measurement. This concludes the Milwaukee HIV Surveillance Annual Review webinar.